All right, whenever you're ready.
All right. Good evening, everyone, and thank you for attending. I will be covering basic questions or questions that pet owners have surrounding vaccinations and common parasites. And I hope you get lots of information and valuable information from today's presentation. A little bit about myself. My name is Suki, and I graduated from the Ontario Veterinary College in Guelph in 2005. And I have been in private practice since then. I decided to open my own practice in November of last year. So, heading on to our first year anniversary at Balmy Beach Pet Hospital. So, that's pretty exciting. We're located in the beaches, and it really has been fantastic being a practice owner. Okay, so some general information, the questions that were posed to me by Juliana, and that's what I've sort of addressed in this presentation, as to, why we vaccinate and, their importance. Of course, we all know vaccines are very, very important, and especially with, COVID striking, that's definitely been in the forefront, trying to establish or develop a vaccination for COVID. Luckily for our pets, we've got vaccines and they work very, very well for a majority of the illnesses that our pets do get. So vaccinations are basically an attenuated or a weakened version of the pathogen. So pathogen just means a bug. It could be a bacteria, it could be a parasite, it could be a virus. And the idea is to give a small amount of this pathogen into our host, so into our pet or ourselves. And the idea is to stimulate an immune response. So we're trying to identify this in small doses and make antibodies and have protection against these bugs without getting sick from the virus or the bacteria from the vaccine. Of course, the benefits of vaccinations, it's to prevent very serious illnesses in pets, in people, things like distemper or parvovirus. We rarely see those things as much anymore because of vaccinations. A lot of viral infections can also be zoonotic to humans. So vaccinations are important to prevent zoonotic infections as well, so such as rabies, leptospirosis, and of course, some vaccinations are required for your pet, such as rabies. When you bring your pet to the clinic or take them to a boarding facility or to dog shows and whatnot, vaccinations are a requirement. And of course, preventing disease in general is a lot better than to actually treat the disease. Testing and diagnosing and treatment is going to be a lot more costly for you, and of course, a lot harder on your pet as well. So there's a lot of vaccinations that are available for your pet. I'm going to talk about them in terms of which ones are mandatory, which ones are core, and then which ones are sort of available but are more so lifestyle based. So in Ontario, the vaccination that's required is, of course, rabies, and of course, the reason being is this virus causes, invariably a fatal disease, and so prevention is definitely it's mandatory. So rabies is required by law in Ontario. Other vaccinations are called core vaccinations, and that's because they do cause serious disease, and they're common enough that we should be vaccinating our pets against them. So when you've gone to your vet's office, I'm sure you've seen the letters DHPP or DA2PP, and in cats FBRCP, and you may wonder what that is. So essentially, DA2PP is a combination vaccine. It is a multivalent vaccine, which essentially means that there's more than one virus that this vaccine is preventing against. So DA2PP stands for the four viruses in dogs: distemper, hepatitis, or also called adenovirus, parvovirus, and parainfluenza. And in cats, FBRCP stands for feline, which means cats, viral, and then it protects against three viral infections called rhinotracheitis, calicivirus, and panleukopenia. So that's what your pets are getting, a series of vaccinations against those things. Now, there are some non-core vaccinations that are available as well, and leptospirosis is a pretty common one that we will discuss with you to protect your pet against, dogs against. It's a bacterial disease that is again, it has zoonotic risk as well to people. So it's a pretty important vaccine as well. Lyme disease is another vaccination for dogs that, go to wooded areas or are cottage country dwellers and, go. So if they're at risk of getting a lot of ticks, Lyme disease is also another vaccination that may provide extra coverage. Bordetella is a bacterial disease that causes coughing in dogs. You may have heard of it as kennel cough. It's not only, dogs don't just get it from visiting kennels. Any place where the dogs are congregating in close enough contact, it's airborne through nose to nose contact. So that can it's pretty contagious, and the vaccine works pretty well for that as well. In cats, the only non-core vaccine is feline leukemia, and that's a viral infection in cats. And we recommend that for cats that go outside or if they dwell within a household with multiple cats. That's also a vaccine to ask your vet about. So vaccinations overall, very, very important for not only the pet safety, but of course the safety of everybody in the home. This is a vaccination schedule that Azra very beautifully developed for me, and it sort of outlines, the stages that we'll be seeing your pup for their first year or two of their lives. They do come to the vet's office pretty frequently in their first year of life. So the first time that the pet is vaccinated is usually when they're around 2 months of age. And generally, a lot of dogs will get this done through their breeders. So the vaccine that they're going to keep, get is getting the same vaccine at 2 months, 3 months, and 4 months. It's the DHPP vaccine that I mentioned earlier. So they'll get that at the first visit, second visit, and third visit. And the reason for the repetitive vaccines is to build a sufficient amount of immune response to make sure that we've got a lot of antibodies to protect your dog against these viruses should they come into contact with any one of those. Some of the other things that we recommend is to have your dog's poop tested, from time to time. Once to twice a year is a good, a good frequency. Not all parasites can be seen, so that's the reason to check for parasites under the microscope. There's a lot of microscopic parasites, and some of these can be zoonotic to people as well. So, for the vulnerable populations like kids and the elderly or people that are immunocompromised, it's very, very important to have regular screening of the poop. And we generally deworm, a pretty consistent deworming protocol as well, especially when they're younger. The younger the pets are, their, immune systems are not fully, not fully developed yet either. So they need a little bit more help in terms of warding off some of these infections and parasites. So Azra has listed here, after we finished our vaccination series, which generally gets done at around 12 to 16 weeks of age. Rabies is given at the last series, which is at 12 to 16 weeks of age. Okay. And after that, rabies is repeated 1 year later. And after that is on an every 3 year basis. Now, how often should you vaccinate your dog for DHPP after their initial series? So that depends largely on your dog's lifestyle. Okay, but I do urge all clients to make sure that the first series, their puppy shots, are done on a set schedule to make sure that we've, really, gotten good immunity against all these viruses. Spay neuter can occur anytime between 5 to 6 months of age. Again, lots of discussion to be had around that as to the pros and cons of spay neutering, and of course, you can address those questions to me later or to your veterinarian, and we can talk about that. Some of the lifestyle vaccines, like I mentioned before, lepto, Lyme, bordetella, can be started again depending on the dog's lifestyle. If your dog is going to be living in the city where there's a lot of wildlife in the city, leptospirosis is something that I recommend. Bordetella is also some vaccine that I highly recommend, just because it's highly contagious and it's easily preventable. So if your pet is vaccinated, it doesn't necessarily mean that they won't get the disease. They might get the disease still. However, the clinical signs resulting from that disease will be mild. Okay, so they won't get serious consequences from the disease because they have some immunity to that virus or bacteria.
Here is a question. So when we get a puppy for first time, there is so many weeks you have to wait until the full set of vaccines are ready for them to go out and socialize. What is that age and why they have to wait?
Okay, so that's a very good question, and I get that a lot. So we've got to think about, we want to make sure that they have an adequate amount of immunity. However, we also want to get our pet out there and socializing. However, I think both of these things can be done in a very controlled manner. I do encourage my, clients to allow their, so the pets don't have to stay in a bubble or a vacuum until they're fully vaccinated at 4 months of age. Okay, I do think dogs need to be, they have to have that social interaction. So I encourage owners to have their dogs interact with dogs of known vaccine status. So, their friends' dogs who are fully vaccinated and fully immune and are not shedding any, contagious diseases. I do encourage that the dogs are getting to socialize with those dogs, and just in making sure that it's a controlled interaction. I don't. I'm not a proponent of waiting till about their 4 or 5 months of age before you start introducing your dog to the outside world, to other dogs. I would discourage taking your dog to heavily dense areas with other dogs where you don't know where the vaccine what the vaccination status is, but exposing your dog to the environment is important. Negative reactions to vaccines can occur. However, if we have to think about the risks and benefits of vaccinations, it doesn't mean that you don't vaccinate because of the possible negative reactions to vaccines that may result. The benefits of vaccinating far outweigh the risks of negative reactions that occur secondary to vaccines. So after your pet has been vaccinated, there are some expected or normal vaccine reactions that don't prompt, that you have to take your pet back to the veterinarian. So it's like when you get your, flu shot or any vaccine, we're a little bit sore at the site of vaccination, might be a little red, you may feel a little down, maybe a little feverish. Those are all okay. Those are normal vaccine reactions. That's, the vaccine doing exactly what we want it to do. We want the vaccine to stimulate our immune system to form antibodies, to form all these memory cells so that we can identify and attack all these, invaders, if that's going to happen. So all of these reactions listed on the left side are normal vaccine reactions and usually dissipate within about 24 hours after vaccination. Some of the abnormal vaccine reactions listed on the right side to be aware of, again, not to become consumed by them because they're extremely rare. So, a little bit of vomiting, diarrhea. If that happens within a day or two, I'd like to know about it. Does that mean I'm not going to vaccinate your dog or cat for it? No, but it is something that we should know about. Some hypersensitivity reactions like swelling around the face, or around the eyes, around the nose, around the throat. Those are important to address right away. That means that your dog or cat is having an allergic reaction to some component of the vaccination and needs some intervention. Okay, so usually we intervene by using antihistamines and some steroids to help slow down that immune response to the vaccine. Hives, similar to how you would get hives, is in dogs. What it looks like, it's little, bumps on their skin. So their hairs stand up on their body, and that's what hives look like. And that's also an indication of a hypersensitivity or an allergic reaction to vaccine. Now, anaphylactic type of reactions are very rare. Okay, so after giving a vaccination, and if your pet experiences shock or collapse or extreme difficulty breathing, that's obviously a very serious, as serious as they get. And like I said, it's very, very rare. In my 16 or 15 years of practice, I've only seen it once in clinical practice, and and usually these scary type of reactions happen right within the clinic. So usually within a few minutes of getting the vaccines. So luckily the pet is right there in the clinic if that's going to happen. So like I say, I generally don't like to scare my clients with all these reactions. I talk about them on the first visit, but just to kind of have the clients, have it and kind of watch their pet for the first 24 hours.
Here is a question. What happens if they actually have a big reaction of anaphylaxis, but still have an important reaction? What then do you do?
Okay, so it depends. So we would have to start to figure out what vaccine is it that they're reacting to. Okay, so in a pet that had mild vaccination reaction, so severe vaccination reaction, it's grounds for not vaccinating that pet. Okay, so I wouldn't vaccinate that pet. However, for the milder types of vaccine reactions, we'd have to start to iron out which ones is it. Now, the way to do that would be to separate the vaccines. So we're not giving a whole bunch of vaccines all at once. Okay, and try to figure out, is it the DHPP vaccine that caused it? Is it the leptospirosis vaccine that caused it? Or is it the Bordetella vaccine that caused it? Mind you, a lot of these vaccines are not highly reactive anyways, but that's the way to figure it out. Now, the DHPP vaccine can be separated into its components. So in a reactive dog, we could just give, say, for example, the parvovirus and distemper, as opposed to giving all four at once. It can be separated.